Question 1. The ICU nurse is caring for a client who had an endovascular coiling procedure to treat a cerebral aneurysm at risk of rupture. Which neurological sign should the nurse immediately report to the provider? A. Loss of consciousness. Loss or change of consciousness, even briefly, should be reported. The Glasgow Coma Scale determines a client's level of consciousness on a scale of 3 to 15, based on the client's ability to open their eyes, respond verbally, and move normally. A score of 15 indicates no abnormalities. Headaches and changes in vital signs are also signs of brain injury but not immediately reportable. Question 2. A client with a known history of panic attacks presents to the emergency department. The arterial blood gas, ABG, results are pH 7.48, PaCO2 31 mm of mercury, PaO2 96 mm of mercury, HCO3 22 meqL. Which acid-base imbalance is present? B. Respiratory alkalosis. Hyperventilation, overbreathing, is a sign that respiratory alkalosis is likely to develop. Panic attacks and anxiety are the most common causes of hyperventilation. Other causes include heart attack, pain, asthma, fever, COPD, infection, pulmonary embolism, and pregnancy. The treatment depends on the cause, but it involves raising the CO2 level in the blood. Normal ABG values are as follows: pH 7.35 to 7.45, PaO2 75 to 100 mm of mercury, PaCO2 35 to 45 mm of mercury, HCO3 22 to 26 meqL. Question 3. A daughter takes her 85-year-old father to the clinic because he is confused and weak. She tells the nurse that his appetite is poor. The nurse also observes that his blood pressure is lower than normal. The provider orders blood work for the client. Which lab result should the nurse immediately report? C. Sodium Na 115 meqL. Sodium serum levels should be 136 to 145 meqL. Hyponatremia causes the brain to swell and must be treated at once. The other lab values are normal: calcium 9 to 10.5 mg dl, chloride 98 to 106 meqL, and potassium 3.5 to 5.0 meqL. Question 4. When assessing a patient in the post-anesthesia care unit, PACU, the nurse should first check the patient's A. Respiratory status. The nurse should always begin by assessing the postoperative patient's respiratory status. Breathing problems are the second most common problem in the PACU. Nausea and vomiting are first. Immediate post-anesthesia complications can include airway obstruction, pneumothorax, hyperventilation, or a pulmonary embolism. Question 5. A 63-year-old female comes to the clinic with complaints of constant bilateral stiffness and pain in her joints. On questioning by the nurse, she also admits to ongoing fatigue and weakness. The healthcare provider suspects the client has rheumatoid arthritis. Which laboratory test will confirm the diagnosis? C. Erythrocyte sedimentation rate, ESR. An erythrocyte sedimentation rate, ESR, measures how quickly erythrocytes, red blood cells, settle in a test tube. A fast rate indicates inflammation, as in an immune disorder, such as rheumatoid arthritis. ESR rates are also high in infection, chronic diseases, vasculitis, or inflammatory bowel disease. A complete blood count, CBC, is an overall indication of health, as well as an indication of underlying conditions. Human papillomavirus, HPV, is the most common sexually transmitted disease. International Normalized Ratio, INR, measures the time it takes blood to clot. Question 6. A client is 2 days post-op after a transurethral resection of the prostate, TURP. The client tells the nurse that he is nervous because there is a small amount of blood in his urine. The nurse explains to the client that B. The bleeding is normal and will decrease in a few days. After and NBSB, transurethral resection of the prostate, TURP, hematuria for several days is normal. The nurse should tell the client that after about a week after the procedure, the amount of blood and NBSB may increase as the scab on the prostate falls off. Some bleeding may continue after the Foley catheter is removed. Irrigation is performed to remove blood clots and facilitate drainage. It does not remove hematuria. Question 7. A new patient is unable to perform oral hygiene. Which of the following instructions should the nurse give to the nurse aide? A. Use a soft toothbrush to brush the patient's teeth after every meal. A soft toothbrush should be used after each meal. Mechanical action is necessary to keep the entire mouth clean, stimulate the gums, and remove plaque. Assessing the oral cavity is the nurse's responsibility. A foam applicator does not adequately clean the teeth. Mouthwash can irritate the mouth. Question 8. To help parents increase the protein intake of their child, which of the following should the nurse encourage? C. String cheese. A piece of string cheese has 7 g protein. Popcorn has 3.1 g protein per serving. A cereal bar can have as little as 1 g protein per bar plus an unhealthy amount of sugar. A banana has 1.3 g protein. Question 9. Which of the following statements about the hemoglobin A1C test is true? A. It is a way to measure diabetic compliance. Hemoglobin A1C, HbA1c, measures the percentage of hemoglobin molecules that are glycated, coated with glucose. Measurement of HbA1c is a useful indicator of how well the blood glucose level has been controlled in the recent past. HbA1c may be used to monitor the effects of diet, exercise, and drug therapy on blood glucose in patients with diabetes. Since hemoglobin molecules are located in red blood cells, which have a lifespan of 110 to 120 days, HbA1c measures the average blood glucose level for about 4 months. Normal HbA1c is less than 5.7%. HbA1c between 5.7% and 6.4% is considered pre-diabetic. HbA1c greater than 6.5% indicates diabetes. HbA1c does not diagnose diabetic ketoacidosis, DKA. Question 10. What is the maximum amount of time for suctioning a patient's respiratory tract? C. 10 seconds. According to the National Council of State Boards of Nursing, NCSBN, review and Johns Hopkins, suctioning should not exceed 10 seconds and it should be intermittent. During suctioning of the respiratory tract, the patient does not receive oxygen, which could lead to hypoxia. The patient should be also hyperoxygenated with 100% oxygen before and after suctioning. Question 11. The nurse meets with a female client after her diagnosis of primary hypertension. Which statement by the client can the nurse anticipate? C. I think there's been a mistake. I feel fine. Hypertension rarely produces symptoms except in extreme cases. That's why hypertension is often referred to as a silent disease or silent killer. The American Heart Association lists sweating, nosebleeds, headaches, anxiety, and facial flushing as myths or unrelated factors. Question 12. A patient is transferred to the post-anesthesia care unit, PACU, after having had surgery with epidural anesthesia. After taking the patient's vital signs, what should the nurse assess next? B. Bladder distension. After epidural anesthesia, the perineal area is the last to regain sensation. The patient may not be able to void or feel the urge to void. Checking for a distended bladder is important to avoid bladder spasms from overextension. If the patient is unable to void, the nurse can get an order to catheterize the patient. The other actions can be performed after assessing the bladder. Question 13. When assisting a conscious client who is choking, which of the following actions would be incorrect? B. Swipe the client's mouth with one finger. Do not swipe the client's mouth with one finger. This could push the blockage farther into the airway. The other actions are appropriate and correct. Question 14. A 58-year-old female is returning to the surgical unit after a total hysterectomy. The nurse knows that pelvic surgery puts the client at risk for several complications. Which of the following post-op preventive interventions will be most important? A. Venous stasis. The nurse knows that thrombophlebitis and formation of an embolism presents the greatest risk. The client should wear elastic stockings, receive adequate fluids, and ambulate. Hypostatic pneumonia is the collection of fluid in the dorsal region of the lungs and occurs especially in persons confined to a supine position for extended periods, such as the bedridden and elderly. This client will be ambulating, so hypostatic pneumonia is less of a concern. Aseptic wound care should avoid infection. Dehiscence is rare, occurring in only 0.39% of hysterectomy surgeries. Question 15. As the nurse prepares to instruct a client who has just been prescribed atorvastatin, Lipitor, which periodic laboratory test should the client have? A. Liver function studies. Atorvastatin is used to treat hyperlipidemia, by increasing high-density lipoprotein cholesterol and reducing triglycerides and low-density lipoprotein cholesterol. It is metabolized by the liver, so clients should have periodic liver function studies, as well as measurements of cholesterol levels. Question 16. Which of the following arterial blood gas, ABG, values represents respiratory function? A. PaCO2. The lungs regulate CO2, so PaCO2 reflects pulmonary ventilation. pH measures the acid-base balance of the blood. HCO3 measures kidney function via acid-base balance. Base excess indicates the excess or deficit of base in arterial blood. Question 17. The nurse is assessing a client with a known history of systolic heart failure. Besides an ejection fraction, EF, of 30%, which of the following findings are consistent with the diagnosis? B. Exertional dyspnea. Exertional dyspnea and fatigue are common findings with systolic heart failure, left-sided heart failure with reduced and NBSB, ejection fraction and NBSB winking sad smiley HFIF, also called systolic failure, and NBSB, the left ventricle loses its ability to contract normally. The heart can't pump with enough force to push enough blood into circulation. This is most common type of heart failure. A barrel chest is a visible symptom of COPD and emphysema. Peripheral edema is generally seen in right-sided, diastolic, heart failure. Note, normal ejection fraction is 60%. Question 18. A client has a blood pressure of 130/84. What is the client's pulse pressure? C. 48. Pulse pressure is calculated by subtracting the diastolic pressure from the systolic pressure, and is measured in mmHg. For this question, 132 minus 84 is equal to 48 mmHg. Pulse pressure represents the force that the heart produces each time it contracts. The normal range is 40 to 60 millimeters of mercury. Question 19. A nurse working in the newborn nursery performs a heel stick on a neonate to screen for phenylketonuria, PKU. If the result is positive, all of the following are true except B. A lifelong high-protein diet is necessary. A PKU screening test is a blood test given to newborns 24 to 72 hours after birth. PKU stands for and NBSB, phenylketonuria, a rare inherited amino acid disorder that prevents the body from properly breaking down the amino acid phenylalanine. All babies born in the United States must have a PKU test. If the result is positive, a lifelong low-protein diet is essential. Question 20. When educating a client with asthma on how to use a peak flow meter, which of the following statements is correct? B. It can help prevent a severe asthma attack. A peak flow meter is a handheld device that measures peak expiratory flow volumes. During an asthma episode, airways often narrow. A peak flow meter can measure this narrowing hours, even days, before the client has any and NBSB, asthma symptoms. If the meter result falls in the green zone, 80 to 100% of personal best, the client is good without any problems. If it falls into the yellow zone, 50 to 80% of personal best, or red zone, below 50% of personal best, immediate action is required. Question 21. After a client has had major surgery, the nurse provides information about the client's condition to a visitor whom the nurse believes is a family member. Later, the nurse finds out that the visitor is not a relative. Which legal violation has occurred? B. Disregard of the client's right to privacy. Providing information about a client's medical status without the client's permission violates the client's right to privacy and confidentiality. It also puts the nurse and the institution in legal jeopardy. The other options are incorrect. Question 22. A pediatric nurse has been assigned to assist with a bone marrow biopsy for a 7-year-old girl. Conscious sedation will be used for the procedure. What is the nurse's primary responsibility? A. Monitoring the child during the procedure. Every procedure requires that one team member be solely responsible for monitoring the patient. In this case, the pediatric nurse will monitor the child's vital signs, reflexes, and response to the procedure. The nurse will not leave the patient to update any family members. Question 23. Before inserting a nasogastric (NG) tube, the nurse estimates the length needed by measuring. A. From the tip of the nose to the earlobe to the xiphoid process. Before inserting a nasogastric (NG) tube, the nurse should estimate the length of tubing needed to reach the gastric body, mid-stomach. Using the nose-ear-xiphoid (NEX) method, the nurse measures the tubing from the tip of the nose to the earlobe to the xiphoid process. Question 24. Nurse A is covering for Nurse B while Nurse B takes a meal break. One of Nurse B's patients tells Nurse A that they keep having increased post-operative pain during Nurse B's shifts. What is the most appropriate action for Nurse A? C. Ask the nursing supervisor to review the client's medication administration record. Rather than attempt to intervene directly, Nurse A should follow the chain of command and notify a supervisor of the client's complaint. The client should not be ignored, but it is not Nurse A's responsibility to investigate or collect more information. When opioids are involved, an investigation is indicated by the proper authorities. Question 25. What is the cardiac rhythm on this ECG strip? B. Ventricular tachycardia. Ventricular tachycardia, VT, refers to a wide QRS complex heart rhythm indicated by a QRS duration beyond 120 milliseconds originating in the ventricles at a rate of greater than 100 bpm. This can be hemodynamically unstable, causing severe hypertension, and can be life-threatening. Supraventricular tachycardia is a term used to describe any heart rhythm that is greater than 100 beats per minute originating from above the AV node, the atrium. Sinus tachycardia is a normal rhythm and GT, 100 bpm. Ventricular fibrillation is an arrhythmia with rapid, erratic electrical impulses. This causes the ventricles to quiver uselessly, instead of pumping blood. ECG credit, Creative Commons Jiniger. Question 26. The nurse is preparing a client for an abdominal paracentesis. What is the usual position for the client during this procedure? C. Supine. Abdominal paracentesis is a diagnostic and therapeutic procedure used in the evaluation of a variety of abdominal problems, including ascites, abdominal injury, acute abdomen, and peritonitis. The usual position is supine, with the head of the bed slightly elevated or the client's head resting on the pillow. An alternative is to have the client sit upright on the edge of the bed, feet resting on a stool, and back supported. Some providers prefer the lateral position. These positions allow the intestine to float posteriorly, to avoid laceration when the catheter is inserted. Question 27. Your home health client has been vomiting for several days. You now find her lying in her bed. She is pale and lethargic, and her eyes are dull. She is also anxious. Which of the following is most likely? B. Hypovolemic shock. Although hypovolemic shock usually results from traumatic injury, dehydration from vomiting or diarrhea can be a risk factor. Older patients are more severely affected. Hypovolemic shock can lead to heart failure or stroke. Hypovolemic shock also causes a feeling of anxiety, resulting from a decrease in circulating oxygen. Fluids should be replaced intravenously. Question 28. Before administering an intermittent enteral feeding by nasogastric tube, NGT, what is the nurse's first action? C. Verify proper tube placement. Before administering an enteral feeding, the nurse should ensure that the NGT is still properly placed in the stomach. Absent bowel sounds do not necessarily indicate lack of peristalsis. Clients are placed at 30 to 45 degrees. Residual is measured before each intermittent feeding. Question 29. The nurse is performing hourly checks on a client who has just had an application of a full leg plaster cast. When assessing the toes of the casted leg, which of the following signs indicates neurological impairment? B. Inability to wiggle toes. Inability to wiggle toes indicates a neurological impairment. The other options are signs of circulatory impairment. The primary concern following the application of a plaster cast is to prevent complications. Neurologic and circulatory assessments should be performed hourly for 24 to 48 hours. Signs of neurological impairment for this client include inability to move the toes, tingling, and numbness. Circulatory impairment signs on the affected side include cool toes to the touch, unequal pulse, pale color of the toes, and poor capillary refill time when toenails are pressed. All of these should be reported and treated immediately. Question 30. The nurse serves on the hospital's ethics committee. Which item is appropriate for the committee's agenda? C. A nurse who was seen taking a patient's controlled drug. Ethics means the moral principles that govern a person's behavior or the conducting of an activity. Taking a medication that is prescribed for another person is unethical and should be reported by the nurse who witnesses it. Placing a baby for adoption and refusing treatment are not ethical dilemmas. Elder abuse is a matter for law enforcement agencies. Question 31. The nurse is inserting an indwelling, Foley, catheter into a male client. After urine begins to flow into the catheter tubing, what is the next step? B. Advance the tubing 1 to 2 more inches, 2.5 to 5 centimeters. After inserting the catheter about 7 to 9 inches, 17.7 to 22.5 centimeters, and urine begins to drain into the catheter tubing, the nurse should advance the tubing 1 to 2 inches further to ensure the tip of the catheter is placed within the bladder. After that, the balloon can be inflated with 10 milliliters sterile water, or per the instructions. Irrigating a new indwelling catheter is not necessary. Pulling tubing back is incorrect. Question 32. A 72-year-old female is scheduled for a coronary angiogram in the morning. When the nurse does post-procedure teaching, which instruction should be included? B. The client's leg must be kept straight for 8 to 12 hours post-procedure. An angiogram, also known as an arteriogram, is an X-ray of the arteries and veins, used to detect blockage or narrowing of the vessels. The procedure involves inserting a catheter into an artery in the leg and injecting a contrast dye, making the vessels visible on the X-ray. Complete bed rest is prescribed for 8 to 12 hours after the procedure, keeping the leg with the puncture site straight. NPO is maintained before the angiogram. The client may eat as soon as safely possible. Question 33. While providing postoperative care for a 7-year-old who has had a tonsillectomy and adenoidectomy, which is the appropriate nursing action? A. Observe for signs of post-op bleeding. The nurse should be alert for any signs of post-op hemorrhage. Appropriate actions include direct observation of the throat, checking for vomiting of bright red blood, watching for continuous swallowing, and noting any changes in vital signs. The other options all present a risk of dislodging a blood clot or promoting post-op bleeding. Question 34. A high school athlete sustains a severe wrist injury during practice. The athlete's parent takes the athlete to the emergency department. After an examination and X-ray, the healthcare provider, HCP, diagnoses an open fracture and prescribes a splint for the wrist. The athlete asks the nurse why a cast wasn't applied. What is the nurse's best response? C. We expect swelling and need to be able to adjust the splint. A splint, sometimes called a half cast, is a device designed to immobilize an area of the body to allow for healing. Splints are frequently used with soft tissue injuries such as sprains, overuse injuries such as tendinitis, and traumatic injuries such as joint dislocations or complex bone fractures. Fractures that are open or displaced or need surgery where a great deal of swelling is expected can be appropriately treated with a splint. Splints can prevent neurovascular compromise, compartment syndrome. A cast is used for fractures with a minimal amount of swelling. Examples are closed fractures, with no open wound, non-displaced fractures, and displaced fractures after they have been reduced. Question 35. When a nurse reports to work in her medical surgical unit at the hospital, she is told to go to the obstetrics unit for her shift. The nurse has no experience in obstetrics. What is her most appropriate action? B. Float to the obstetrics unit and perform safe and familiar tasks. While no nurse likes to float to another unit, most hospitals do require it to assist with short staffing or similar issues. Refusing an assignment can result in discipline or dismissal. The nurse should report to the new unit and ask for an assignment or tasks that she can perform safely to help the unit. Question 36. When checking a client's stool for occult blood, the nurse knows that a false positive result can be caused by consuming B. Rare steak. Steak is a red meat, containing a high level of iron, which can cause a false positive result. How it is cooked doesn't matter. The client should avoid all red meats, beef, pork, lamb, and liver, for 3 days before they are tested for occult blood. Question 37. The nurse working on the surgical unit receives a patient following an above-the-knee amputation. Which position will the nurse initially use for the patient? B. Elevate the foot of the bed. For the first 24 hours, elevate the foot of the bed to reduce the risk of post-operative edema. After that, the residual limb should be placed flat on the bed to prevent hip contractures. Lying prone twice a day stretches muscles at the front of the hip. Reverse Trendelenburg is inappropriate. Question 38. A 50-year-old blind and deaf patient has been admitted to your floor. As the charge nurse, what is your primary responsibility for this patient? B. Provide a secure environment for the patient. The American Disabilities Act, ADA, prohibits discrimination against anyone who has a disability. Hospitals and healthcare facilities must provide access and accommodations so that patients, visitors, and staff are not at increased risk for injury. Question 39. A client with a diagnosis of COPD is to be discharged home with oxygen therapy. When the nurse gives discharge instructions, which of these is correct to include? A. Check and record the O2 tank level on a regular basis. For a client who relies on a constant O2 level, checking the level in the tank is the first priority. Oxygen is highly combustible, so precautions should be taken near any type of flame, even if chances are small that it will ignite. When the client is traveling, the tank should be secured to prevent damage to the tank or the client. For deliveries or issues, the client should call the O2 supplier, not the provider. Question 40. A client with cancer has a routine CBC before receiving chemotherapy. Which of the following values should the nurse report to the provider? A. Platelet count, PLT, 20,000 kL. The nurse should report the platelet count of 20,000. General CBC reference ranges are RBC 4.70 to 6.10, WBC 4.80 to 10.80, HGB 12.6 to 17.4, platelet count 130,000 to 400,000. Low platelet count is also called thrombocytopenia. Thrombocytopenia is a common side effect of chemotherapy and can cause treatment to be delayed. A platelet count of 20,000 indicates the need for bleeding precautions. Question 41. The nurse is caring for a fresh post-operative cholecystectomy client with a T-tube in place. As the nurse records the output from the T-tube, what is the typical drainage for the first 24 hours? D. 300 to 500 milliliters. During the first 24 hours post-operatively, drainage from a T-tube is about 300 to 500 milliliters of thick, blood-tinged, bright yellow to dark green bile drainage. Report drainage greater than 500 milliliters per day. After about 4 days, the amount will be less than 200 milliliters per day. Question 42. A nurse on an evening shift prepares to administer a medication to a client that was ordered by the provider during the day shift. The nurse realizes that the dose might be too high, based on the nurse's own calculation of recommended milligram/kilogram of weight. What is the nurse's best action? D. Verify the dosage with the provider before administering. The nurse is responsible for ensuring that the client receives the correct dosage, so the nurse should contact the provider and verify that the higher dose is intended for this client. The nurse should have the client's weight and the recommended dosage when contacting the provider. Question 43. What is the cardiac rhythm on this ECG strip? D. Sinus bradycardia. Sinus bradycardia is a rhythm in which the rate of impulses arising from the sinoatrial SA node is lower than expected. Bradycardia is considered to be less than 60 bpm, but can be affected by factors such as AV-blocking medications, age, and physical condition. It can be normal, or may require treatment. On a surface ECG, the P wave is normal preceding every QRS complex. Third-degree heart block, also called complete heart block, occurs when no action potentials conduct through the AV node. P waves are unrelated to the QRS complexes. Myocardial infarction is incorrect. ECG credit, Creative Commons James Hellman, MD. Question 44. When a client is receiving a continuous intravenous infusion of heparin sodium, which of the following should be assessed by the nurse? D. Ecchymosis. The nurse should monitor the client for bruising, or ecchymosis. Other signs of bleeding include hematuria, tarry stools, and bleeding gums. Thrombophlebitis is the formation of clots, usually in surface veins with poor circulation. Hypoglycemia and hypertension are incorrect choices. Question 45. On reviewing the culture results of a newly admitted patient, the nurse notes that the patient has methicillin-resistant Staphylococcus aureus, MRSA. Which transmission-based precautions should be instituted for this patient? D. Contact precautions. Besides standard precautions, contact precautions include use of barrier personal protective equipment, PPE, such as gloves and goggles. Diarrhea, draining wounds, and secretions containing MRSA can be transmitted by contact. Enteric precautions are for pathogens transmitted by the GI system. Droplet and airborne precautions are for pathogens from the respiratory tract. Question 46. A client in her 34th week of gestation phones the prenatal clinic to report that she has had a severe headache for 2 days and is now experiencing blurry vision. What is the nurse's best response? D. Tell the client to come to the prenatal clinic immediately. The nurse should tell the client to come to the prenatal clinic immediately. The client's symptoms are consistent with preeclampsia and should be evaluated at once. Preeclampsia is a serious hypertensive emergency that can occur after 20 weeks gestation. Signs and symptoms include headaches, blurred vision, hypertension, edema, and proteinuria. The other options can be considered after preeclampsia is ruled out. Question 47. Following a major surgical procedure, the nurse applies a sequential compression device, SCD, to a client's legs. The client's spouse asks the nurse about the purpose of the SCD. The nurse explains that the SCD will prevent D. Formation of blood clots. The purpose of a sequential compression device, SCD, is to prevent deep vein thrombosis, DVT. A DVT can cause a life-threatening condition called pulmonary embolism, PE. An SCD prevents a DVT by improving blood flow in the legs. It wraps around the legs and inflates with air, imitating walking. The SCD does help with peripheral leg edema, but that is not the main purpose. It does not prevent loss of muscle mass or development of varicose veins. Question 48. The nurse hangs a piggyback with the first dose of a new medication for a client. Checking back 15 minutes later, the nurse realizes that the dosage is twice what the physician ordered. What is the nurse's first action? D. Immediately stop the infusion. If the nurse identifies an medication error, the nurse should stop the infusion and observe the client for any adverse reactions. The prescribing provider must be notified and an incident report must be completed, but the first action is to care for the client. Adjusting the flow rate is incorrect. Question 49. The nurse is teaching a client with emphysema how to do pursed lip breathing. The nurse knows it will help the client because D. It helps keep the small airways open and prevents air trapping. Decreased elastic recoil results in airway collapse during expiration. Air gets trapped in the lungs, and exhalation becomes difficult. Pursed lip breathing improves ventilation by keeping the small airways open and releases air that is trapped in the lungs. Question 50. A client with a history of severe alcohol abuse presents to the emergency department, ED, after vomiting large amounts of blood. The client admits to recently having black, tarry stools and feeling very lightheaded. The ED healthcare provider, HCP, gives a preliminary diagnosis of ruptured esophageal varices. Which of the following nasogastric tubes will be used to treat the condition? D. Sengstaken-Blakemore. The Sengstaken-Blakemore (SB) tube is a nasogastric (NG) tube with 3 ports on one end and 2 balloons on the other. One balloon goes into the stomach and is filled with air. The second balloon is placed and inflated in the esophagus. The third port is a gastric suction port that suctions air and fluid from the stomach. Esophageal varices develop when normal blood flow to the liver is blocked by a clot or scar tissue in the liver. To bypass the obstruction, blood flows into smaller blood vessels of the esophagus that aren't capable of carrying large volumes of blood. The vessels can leak blood or even rupture, causing life-threatening bleeding. An E-wall tube is a single lumen, used for gastric lavage, pump the stomach. A Salem sump tube, gastric sump, is a double lumen. The larger lumen is used for suctioning and irrigation and the smaller lumen is used to vent. The Levin tube is the most common, a single lumen tube used for continuous gastric drainage and gavage feedings.